Hello guys, in this video we are talking about brachial plexus. We will learn brachial plexus. So initially, what is a plexus? Plexus is just a network of nerves. Plexus is network of nerves. Nerves will form a network and then supply particular region. So brachial plexus means plexus supplying arm, forearm and hand region. So this is very important plexus. So how it is formed? So brachial plexus is formed by C5, C6, C7, C8 and T1. These are the root values. So these root values will form brachial plexus. Okay. So if sometimes C4 will give contribution and sometimes T2 will give contribution. If the C4 is giving contribution is called as prefixed, and if T2 is giving contribution is called as postfixed. So now I will be teaching an easy diagram so you can remember how to draw brachial plexus easily. So let's get started. You have to draw firstly C5, C6, C7, C8, T1, and then you have to draw simple 3 Y's like this: 1 Y, second Y and third Y, and then you have to make M like this and make it a X, and another M, extend it and like this M. So this is our brachial plexus, and just now we will name this. So plexus is formed by roots, trunks. So this is mnemonic: root, trunk, let me give you division, cords and branches. So remember to drink cold beer. So this is the mnemonic. Okay, so this is root values. Okay, these are the root values. Root will form trunk. So you can see this is trunk. Okay, then it will give, this is divisions, and it will form cords subsequently, and it will give branches. Okay, so let me name the branches. This is musculocutaneous nerve, this is axillary nerve, this is radial nerve, and this is median, and this is ulnar nerve. Okay, so once again we will draw this diagram so it becomes an easy thing for us. Okay, so C5, draw Y, 1, 2, 3, and then draw M, make it X. Okay, so this is musculocutaneous, this is median, this is ulnar, axillary, radial. So these are the root values: C5, C6, C7, T8, C8 and T1. So these are the root values. Root will forms trunk, and then division, cord and branches. So let me give you a standard difference. So okay, so these are the root values: C5, C6, C7, T8, C8 and T1. Okay, so it will form trunk, superior trunk, middle trunk and inferior trunk. So then these trunks, as we had draw Y's like this, so these 3 trunks will give divisions. Superior will give anterior posterior, middle will anterior posterior, and inferior will give anterior and posterior. So all the posterior ones will combine and form posterior cord. Okay, inferior's anterior division will combine as medial cord, and lateral cord is formed by anterior division of superior and middle. So this is formation of cords, and then cords will form terminal branches. So we'll get this is okay. So this diagram includes main nerves like musculocutaneous, median, radial, ulnar and axillary, and also the small nerves like small nerves, important small nerves, C5, C6, C7. This will form long thoracic nerve. Long thoracic nerve is called as Bell's nerve, and its palsy like and its paralysis will like winging of scapula. Okay, so and there's one clinical importance. So this is the ops point. Here the 6 nerves will meet, and damage to hair will lead to ops paralysis. Okay, so there are the small nerves. You can just get like medial will give medial pectoral, medial cutanous of arm, forearm, and posterior will give thoracodorsal nerve supplying to latissimus dorsi, superior subscapular nerve, inferior subscapular nerve, and lateral we give lateral pectoral nerve. So these are some important nerves. So let's talk about the important clinical point. Okay, so talking about the Erb's paralysis. Talking about the Erb's paralysis. So Erb's paralysis is paralysis at a point where the 6 nerves meet, and that point is called as Erb's point. So at Erb's points, which nerves are involved? So nerve to subclavius, suprascapular nerve. Let me show it in another diagram. So you can make this is the Erb's point. Let me draw. So this is Erb's point. 1, 2, 3, 4, 5, and 6. 6 nerves are meeting at this point. So it's called as Erb's point. So what are the 6 nerves? This is nerve to subclavius and suprascapular nerve. Okay. The roots are forming here, and it's trunk, and this give divisions. This is anterior division, posterior division. So these are 6 points. And there is one important clinical also. This is called as clump-case paralysis. Clump-case paralysis. Clump-case paralysis is due to undue separation. It may be during parturition. And there's one more clinical important point is brachial plexus block. If let's say there are multiple fractures in hand, and there is a immense pain, and you want to carry out some orthopedic procedure. So to relieve the pain, you can't just block single nerve because it's very hectic, and you can't even just block single nerve with ulnar nerve medial. You can't do it. So we have to block directly whole brachial plexus, and you can block between the scalenus anterior and medius muscle. Okay, so these are the important clinical points. If you want to learn much more detail about the brachial plexus, you can tell me in comments. Thank you guys.